Good morning or good afternoon, wherever you're joining us from today. And thank you for being with us for this second session in the Health Center Preparedness Forum. Next slide. So before we get started, let's briefly review some housekeeping details. This is a webinar session, which means your cameras and audio are turned off. We encourage you to participate via the chat and QA box. For any access needs, please message hosts and panelists in the chat. And we are recording this webinar and we will email the materials to participants within 1 week of this session. And please don't forget to fill out the evaluation form at the end of today's presentation. It means a lot to us and will be very helpful as we prepare for session 3 of this webinar series. Next slide. So again, this is session 2 of the webinar series, Health Center Emergency Preparedness and Response Forum. Today's session will focus on building community partnerships. The presenters will share strategies and promising practices for health centers to enhance partnerships with community-based organizations to support patients before, during, and after emergencies occur. Our next session is scheduled for March 11th, and we will focus on workforce readiness. We hope that you will join us then. Next slide. And we'd like to share a little information about this forum for those that are unfamiliar with it. This forum is a collaboration between 11 different national training and technical assistance partners, otherwise known as NTAPs. NTAPs are funded to provide free training and technical assistance to support health centers in a manner that increases patient safety and health outcomes to effectively serve health center populations. This training and technical assistance often takes the form of communities of practice, state, regional, national trainings, webinars, newsletters, toolkits, and fact sheets. And we gathered here together to address community partnerships because we were hearing and seeing the shared challenges across various special populations served by our partner health centers and lookalikes. To learn more about the NTAPs and the individual priority populations they serve, please visit the link in the chat. Next slide. And we are your facilitators today. My name is Elsie Hernandez. I'm a senior program manager at Health Outreach Partners, and I'm joined by my colleague, Kyranisha Coleman, who is the program director at MHP Salud. And you'll hear from her later in the session. Next slide. And this is your agenda. So we've already gone through the welcome, and we're excited to hear from 2 presenters today. Up first will be Dr. Dori Escobar, and we will hear from John Paul Ruggiero later in the session. There will be a Q&A session after the presentations, so please wait until after Jean Paul's session to ask any questions, or you can put those in the chat, and we will address them during the Q&A session. And we will also be sharing some helpful resources toward the end of the session, and we will wrap up with an evaluation and some closing statements. Next slide. And now I'd like to introduce our first speaker, Dr. Dori Escobar. Dori Escobar has extensive experience in community partnership and program development, community-driven strategic planning, evaluation, and capacity building. After serving as a hospital community benefit leader, Dori founded Co-Action Institute to build partners' capacity for collaborative practice. She recently served as assistant professor and the applied practice director in public health with the University of San Francisco. Welcome, Dr. Escobar.
Thank you so much. It's a great pleasure to be here. Next slide, please. So today, as our host told us, we're going to be talking about health center partnerships for emergency preparedness and response. Next slide, please. I'm going to talk briefly about 3 broad models and frameworks. There are many lessons to be learned and replicated in the field of community health on how and when to build partnerships to support the health of the patients they serve, as well as their communities. I'm going to briefly talk about three broad models or frameworks. One generally is partnership development, engaging stakeholders to improve community health, establishing clear communication, and facilitating relationship building and ongoing moving towards collaboration. Self-healing communities is a model that has evolved over the years. We're going to talk about where it is today in strengthening communities' adaptation and recovery, as well as collective impact, another evolving model that's focused on facilitating multi-sector stakeholders to achieve their shared goals. Next slide, please. So in the area of partnership development, again, this is not necessarily unique to community health centers, but certainly critical, and the flavor may be a little distinct in how we do it in community health. So initially conducting an inventory of the partnership landscape. Who's out there with whom we share some goals and interests, where there are overlaps. As we do that, how do we to generate new insights about how we could work together and who else we could work with? Developing and nurturing relationships is critical. Not only do we identify our shared goals and begin to share our perspectives about how best to achieve those goals, but establishing right from the beginning a system of ongoing communication and relationship building gets us beyond just coordinating our activities to really building a deep partnership that enhances our outcomes. And then together formulating shared vision, mission, goals, and an action plan. And it's important when we think about our action plan always, but in particular when we're doing a collective action plan with different stakeholders, we want to make sure that it's measurable. We can track it. We know when we're making progress. We know when we need to make adjustments, and we have those conversations together. And as you can imagine, this is one of the many places in which those nurtured relationships come into play, because if we may have different opinions about how to achieve a shared goal, it's important to have that foundational working relationship in order to work through those challenges. And then on an ongoing basis, evaluating both the quality and the effectiveness of our partnership. The partnership is in of itself can be an important outcome for the health center and the other partners involved. Next slide, please. So this, I know there's a lot of words on this, but you will have access to the slide deck, it's my understanding. It's important when we're thinking about partnerships that we don't think only about external partnerships, but how do we gain internal support for doing this work together with the different stakeholders in our community? And so we can expand our impact by engaging these internal stakeholders as well. And so when we do that, we want to be mindful of the perspectives and the priorities of the different stakeholders. So this is kind of like a helpful guide to formulating your strategy for communicating and engaging these internal stakeholders. And folks at different levels of the organization with different functions naturally have different focus and different priorities. So we want to be mindful of that as we're looking to engage their support. So at an executive level, they're really focused on that shared vision, what's possible, and how are we going to be tracking and measuring what's possible. What we want to look at, we want to let them know what steps, concrete steps we're going to be able to take to achieve the results, and how we're going to know when we're making change, and how we're going to assess what happens when we don't make change. And what we have on the far side, the far, I don't know what side of the left-hand side on the screen, that column of visionary, pragmatist, conservative, skeptic, those are different leadership styles and work styles. So an executive may, based on their personal style, may have a different approach to their role. And so we want to really know our internal partners at an executive level, director, manager, and the practitioners, both the clinical and the non-clinical stakeholders within our organization. So not only their role, but their personal styles. Is this person a pragmatist? They're going to want to know what concretely is being planned. How are we going to do it? How are we going to measure it? So again, I want to just put this in as something to consider when we're talking about partnerships. It starts with our internal partners to make sure that as a health center, as an organization, we're moving forward together and are addressing any concerns or questions that may come up that we can then work through with our external partners. Next slide, please. So I'm sharing some examples for each one of the models or frameworks. I'm sharing an example from my home community, Sonoma County. These are not necessarily initiatives that I'm leading, but I, as a longtime partner and stakeholder in community health in our county, have been involved with all of these organizations and stakeholders in different moments. And I find these examples to be very powerful. So there's an organization called Sonoma County Community Organizations Active in Disaster, or COAD. I know there are COADs in other communities. In Sonoma County, again, with the long history of collaboration and partnership and working together, there are relationships that have already been built that facilitate these ways of coming together under these different frameworks. So with Sonoma County COAD was formed to ensure an effective service delivery throughout the emergency mitigation, preparedness, response, and recovery. The COAD serves as a liaison with local government and emergency responders through the EOC, or the Emergency Operations Center. And together, the different partners share resources, volunteers, and coordinate during and after the disasters. I know that we all have experienced a variety of disasters, and those of us in California, both Northern and Southern California, have really had the unfortunate opportunity to hone this with our fires. And so in Sonoma County, starting in 2017 with the Tubbs and the Nun fire, our community has really learned a lot and improved the application of these partnership models. So in all of the models that I'm sharing with you, local health centers and our health center coalitions based on different regions of the counties are involved. Some have founded some of these collaborative groups, others are actively involved. And that's the case with COAD. Next slide, please. Self-healing communities is another model that is very helpful for community health centers that are building partnerships with different sectors to prepare for and respond to emergencies in their communities. And it's grounded in these core principles of holistic care, which is obviously very congruent with community health centers, multi-sector leadership. So not only are we engaging with partners to develop a shared vision and goals and a plan, but we share the leadership as well. And that strengthens the relationships, and in that way, the work and the outcomes. It also relies on activating and building community resources and networks as much as possible. Every community needs to engage and bring in external resources as well, but it's really important to be aware of and to engage and utilize our own community's resources and networks as well. Next slide, please. So the Sonoma County Resilience Hub is an excellent example of self-healing communities. This is, again, another initiative of various stakeholders that came together as a result of one of our many natural disasters in the last 5 to 6 years here in our county. And the Sonoma County Resilience Hub promotes mind-body skills and connections, and it was founded by the Santa Rosa Health Center, which is probably the largest FQHC that we have in Sonoma County. They built a partnership initially and have continued to use the model developed by the Center for Mind-Body Medicine in order to build adaptability, reduce stress, and strengthen mental health for everyone in the community that was directly impacted and indirectly impacted by our multiple natural disasters. And they developed 2 tiers of training. One is a training open to all community members, caregivers, case managers, mental health professionals, and educators. And then a second tier to build a core of leaders from amongst folks who graduate from the program in order to continue to build participation of community members. So it's, again, building on an evidence-based practice developed by the Center for Mind-Body Medicine, taking the critical relationship and role that Santa Rosa Health Center has in our community and using that to proactively address mental health and health needs in the case of emergencies. Next slide, please. Then collective impact, I think, is something that folks are familiar with. I don't know if you're familiar with the fact that it's been evolving as a framework. So now folks talk about collective impact 3.0. And the key strategies that are used in collective impact are community analysis, different stakeholders coming together and looking at what's going on in the community, where are the gaps, where are the assets that could be mobilized, and then through that developing shared goals and objectives, and each involved stakeholder taking leadership on certain actions to achieve those shared goals. Once again, very reliant on ongoing communication and having not only communication with the stakeholders directly involved in the shared efforts, but also with the broader audience, the constituency of the member organizations, participating groups, and then ongoing evaluation and leading to a new analysis. So one of the ways in which collective impact has evolved over the last, I guess, couple of decades since it's become widely used in community health is the leadership paradigms kind of shift from just a stagnant management to really movement. How do we build on an ongoing basis our ability as a community to prepare for, respond to emergencies from the community health perspective? So they talk about in the collective impact framework, talk about 5 conditions. And currently in the 3.0 version, the 5 conditions are having a shared agenda, agreeing on shared measurement of our objectives and how we're going to track what we're doing together, mutually reinforcing activities. So not just everyone agreeing on what we want to achieve and going off into their own corners, but ensuring that as we develop a shared plan, each stakeholder, organization, groups, particular activities are going to maximize the impact of the activities of the rest. Again, with continuous communication and having a backbone organization or a container for change, as we call it. So who is going to kind of administer this collective impact that takes into account not only what the community needs, but what the community wants, and how we involve the community in it, and then who's going to hold it all for us to help move it forward. Next slide, please. So the Northern Sonoma County Coalition is a great example of a collective impact initiative. It was initially convened. Oh, do I see a Northern California coalition member? I saw a little heart going there. Initially convened and coordinated by the Northern Sonoma County Health Foundation. For those of you who are never been to a beautiful Sonoma County, it's a geographically a very large community, but not a lot of towns and a lot of rural space in between. So Northern Sonoma County is really the community health centers there, as well as the health foundation, have been instrumental in building the capacity of communities that were formerly pretty isolated. So the Northern Sonoma County Health Foundation convened this coalition, and members include local health centers as well. We've got 2 local health centers in Northern Sonoma County, and it's focused on building the capacity of the community to meet the needs in the entire region that are impacted by the multiple wildfires. It's a particularly vulnerable region for wildfires. And so the coalition builds and shares resources, training, and expertise, and strengthens an integrated system of care throughout the Northern Sonoma County region. It's a very, very powerful and effective stakeholder shared effort. Excuse me. Next slide, please. Oh, that's it. So I'm excited to be part of this conversation, and I will be, along with all of you, excited to be seeing the slides from our next presenter and to be having some conversation and address any questions you might have. Thank you. I'm not sure, Elsie, who I should pass it on to. Thank you.
It's me. Thank you so much, Dory. That was amazing content. We appreciate it. Look forward to asking you questions later. So up next, we have Jean-Paul Rogero. Jean-Paul has over 25 years of experience in healthcare leadership and community engagement. He currently serves as a director of community outreach at Healthcare Network. He administers programs addressing health disparities while managing a dedicated outreach team. Previously, John Paul managed acute care operations at David Lawrence Center, overseeing crisis stabilization, Baker Act services, and inpatient substance abuse programs. Before relocating to Florida, he directed the emergency management program at the Primary Care Development Corporation in New York for 9 years. Everyone welcome Jean Paul.
Thank you. Thank you so much. First and foremost, thank you for putting today's presentation together and inviting us speakers to present and share our experience. I would like to piggyback on Dr. Dory's message regarding community integration and resiliency. First and foremost, I would strongly urge you to foster a good, solid working relationship with your local healthcare coalition and the person who oversees emergency management at your state primary care association. PCAs facilitate the sharing of information with health centers through electronic alerts and conduct outreach to increase awareness and participations in various initiatives, let it be in the region or state pandemic. And reach out to your county emergency management department and build a solid rapport with them, and try to find a bridge to the county EOC. When disasters strike, that's where all the resources are being allocated and will be distributed. So it's just piggybacking on Dr. Dory's message. Before we dive into the steps, let's first understand why these exercises, full-scale exercises, are of importance. Next slide, please. Oh, next slide. I spoke over that one. My apologies. Full-scale exercise validate emergency preparedness plan. It improves interagency coordination and enhance staff readiness. They also meet the regulatory requirements under the CMS Emergency Preparedness Rule, which came about in early 2021. The rule requires community health centers participating in Medicare and Medicaid to develop emergency preparedness plans and conduct exercise to validate those plans and ultimately train staff accordingly. Beyond compliance, these exercise helps us apply lessons learned, maintain operation under stress, build community trust. If a real world event activates the emergency plan, you basically are reducing the total number of drills that is needed, given that you are facing a real emergency, but proper documentation must come into play. Next slide, please. At Healthcare Network, we're in the planning stages for a full-scale exercise um, scheduled to take place sometime during the month of March, to be more exact, March 19. We will test our ability to set up and operate an alternate care site during a medical surge post-hurricane storm. We're using the Homeland Security Exercise and Evaluation Program framework, which is also known as HC. The framework provides a standardized approach for planning, conducting, and evaluating exercise. This common approach ensures coordination and effectiveness through the various core elements. I cannot stress enough, please take into consideration all the core elements needed to pull a well-planned exercise. As we can see here in the slide, the core elements are planning and design, conduct, evaluation, and improvement. Do not take any of them lightly, for significant planning comes into play for each of the categories. When we're talking about exercises, drills and exercises, there is the discussion base versus operation base. In a very simplistic manner, a discussion-based exercise focused on talking through plans and procedures is very low stress, right? You usually have directors, executives, and key stakeholders around the table and discussing a scenario is being played out. Where operation-based exercise involve actual deployment of personnel and resources in a simulated real-world scenario. In short, discussion-based equals plan, review, and dialogue, where operation-based is hands-on execution and real-time response. With that foundation in mind, let's break down the key building blocks of a full-scale exercise. Next slide, please. So planning, the design and execution of a full-scale exercise involve the various critical steps. The first one being planning, team, and meeting. It's important to form a multidisciplinary team that can come together and basically craft the full-scale exercise from beginning till end. At Healthcare Network, we pulled facilities director, risk management director, myself, who outreach, and senior operations director as well. And we assign clear roles and responsibility and hold regular planning meetings to ensure alignment of efforts. We looked at our HVA. Basically, we want to make sure that we identify gaps in previous exercise or real world events and review your regulatory requirements. It's important to define scope and purpose. Okay, determine the exercise type. Is it going to be a full scale, functional, a tabletop? And clarify exactly what will be tested. Are we just testing a communication piece? Are we setting an alternate care site? Or is it a combination of various things that are being tested? Set realistic boundaries for time, resource, and complexity. As always, develop smart objectives. And when designing the scenario, create a realistic scenario. Look at what is common in your region, but also look at things that has not happened historically, yet there is a high impact should it happen. Documentation is important to prepare essential documentations throughout the planning of the exercise. You're going to develop an exercise plan. You're going to develop a controller and evaluator handbook. You will also have to do a briefing as to the safety aspect of the exercise itself. When conducting the exercise, once again, brief participants on roles, rules, and safety protocols, and assign a safety officer to monitor the activities in real time. Next slide, please. Here we have some common challenges in conducting a full-scale exercise. We quite often hear coordinating with multiple department and external partners take time, and conflicting schedules can come into play, and it can delay the overall exercise date. Yes, that is very true. That's why many times it takes about 3 to 6 months to plan a well-designed exercise. Financial limitations. Significant resources come into play when planning, executing, and evaluating an operations-based exercise. Remember, operations-based, you're actually moving resources, personnel. Depending on what's being tested, you could spend a significant amount of resources for that particular exercise. For our uh, exercise at Healthcare Network, we are deploying providers, nurses, front staff. We're deploying our mobile units, Starlinks. So we're quite excited about this full-scale exercise, and certainly look forward to it. Communication system failure occurs at times. So confusion between exercise messages and real emergencies can occur. For example, a simulated code gray alert accidentally triggers a real security response because it wasn't clearly marked as an exercise. So when you are conducting an exercise, just make sure that whatever is being communicated, you communicate it as this is an exercise. Because if you say something over the radio and folks do not hear or do not think that it's an exercise, they may be calling law enforcement. So please, 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 communication is key, and safety is key throughout the planning, execution of an exercise itself. Next slide, please. And I do have to apologize. A full day training on drills and exercise usually takes about a day of training. And here we are trying to do it in half an hour. So my apologies if things are looking a little bit too rush, okay? Um, After the exercise, you should conduct a hot wash, also known as a debriefing, on how the exercise went. Do not forget to collect and gather evaluations form, for it will help craft your after action report. And you identify gaps and ultimately update your emergency plan protocols. Emergency management protocols are living documents that requires continuous review and improvement. For that is key for staying ahead, particularly during real emergencies. By following the HC project management illustration that we have on this slide, you will have ensured to have taken the required steps needed to execute a successful full-scale exercise. Remember, success in one area doesn't mean everything worked perfectly. For example, while field operations may run smoothly, it may be at the health center EOC, they may be struggling with situational awareness because certain things are not being communicated from the field to the health center EOC. And without any further ado, I think I am on the last slide. Next slide, please. And at this point, I guess we will take any questions.
Thank you
Thank
so
you.
much, John Paul.
You're most welcome.
Dory, would you mind coming back on for me?
I am here.
All right, fantastic. Okay, we are going to open the floor for questions. Question number one that we had, could you all highlight any standout relationships between health centers and departments of public health as it relates to emergency management?
I can share something. I arrived to Healthcare Network back in 2022, and Collier County had faced a hurricane. I believe it was Ian, and basically the Department of Health has lost all of its tetanus shots during that hurricane, and we had a great working relationship. My understanding that the health center had a great working relationship with the county, not only the county emergency management, but the Department of Health. And the Department of Health reached out to the health center, basically the outreach team, and said, "Folks, we lost all of our vaccines, tetanus vaccines, and we know there are certain areas that have been impacted, and there will be public health emergencies because of the storm." So what we did was go out to the community and vaccinated those individuals in those high risk areas. So I gotta say that I kind of hit the ground running because The storm occurred towards the end of September, and I arrived in August. So I was wearing my emergency management hat, even though my true role was being that of a community outreach. But that was great collaboration that I had not only with the Department of Health, but we also had great collaboration with the county emergency management department.
I can add that here the examples that I shared in my presentation were all specifically related to emergency preparedness and response. And as I mentioned, communication relationship building is foundational to everything. So those uh, shared efforts, I think, were only possible because our health department, public health team, and our community health team, and our uh, three nonprofit health systems in the county have spent decades building relationships and working together. And so there is an initiative that was begun by our public health division with the collaboration of health centers, hospitals, and multiple diverse stakeholders from around the county. Started was called Health Action. Started, I believe, in 2007, a minute ago, and then evolved from that to it's a nonprofit now, and recently merged with a larger nonprofit called Sonoma Connect and Sonoma Unidos. And through those relationships and that experience and learning what works well and what doesn't work well in these kind of collaborations, our communities were set up to respond quickly and effectively in the case of emergencies and then learn from there. So I would say since 2016 or 2017, we have had back-to-back natural disasters, multiple huge wildfires and urban fires, and flooding, and atmospheric rivers, and also the COVID pandemic. So having the foundation and the history of knowing how to work together, understanding the needs, the strengths, and the limitations of the different sectors, from the public health agencies and other public agencies to the health centers, the FQHCs, the non-FQHCs, the nonprofit health systems, the grassroots community efforts. I think that really set our community up well to be able to not only pivot quickly. For example, we were a couple of years into multiple fires and had the whole evacuation system down. And then during the pandemic, we could not concentrate people at the fairgrounds in the way that we had. So the county developed a partnership very quickly with Sonoma State University, and we brought folks, evacuees there to the dorms because the students had been sent home. But again, I think all of these efforts were able to be developed quickly and effectively because of longstanding relationships. So I can't highlight that enough.
Thank you both so much. I want to remind our audience that if you have any questions, please drop them in the Q&A box. As we go along, we will try to get to them. So another question was, what if the corresponding emergency management is ignoring previous requests to speak on emergent matters? Do you all have any suggestions of how to handle that?
My apologies. Do you mind repeating that question?
Sure thing. The question was, what if the corresponding emergency management is ignoring previous requests to speak on emergent matters? They elaborate a little more. They mentioned that they have essentially violated their role as public servants, and this person needs advice on how to move forward based on inadequate communication between professionals that are not reflecting competence in their current roles due to following inadequate training.
I would, I if I was in that type of scenario, I would find out who is the person that I'm communicating with, who's their supervisor, and I will write reach out to them and have a conversation and just let them know what is it that I'm attempting to do, what I have attempted to do with someone that reports directly to them. And I hope to find common ground so that we can move forward. I think you do more with honey than with vinegar. You could go a different route and reach out to an elected official, but I think that would be I would reserve something of the sort if I don't get anything by my first approach. I hope that was clear.
I think that's great advice, Jean Paul.
Yeah.
I think the only thing that I would add is that frequently people are need help communicating what their concerns are, and where they, in my experience, sometimes critical partners are resistant or not as active in communication and collaboration because they're fearful that it's going to impede with what they are charged doing, or they're not, or they're being blamed, or they're not being heard. And so I think it's important, as Jean Paul says, to reach out and do your best to engage the folks who have influence and the folks who have power to inquire what are your concerns? How can we help address them? Particularly, I would say from the public agencies, in some instances, they're just anticipating being blamed for problems just because of their role in the community. And so really hearing them out and respecting the diverse needs and concerns of all of the partners, public and nonprofit and nonprofit. I think it's really important.
Thank you both for that. Another question is, do you all have any advice on starting a conversation regarding pilot studies with nonprofits seeking out community partnerships with evolving organizations? For an example, a primary contractor that will ensure proper oversight strategies to relate information to appropriate agencies. I see those wheels turning.
Could you repeat the
Sure.
for example piece of it?
Sure. For example, a primary contractor that will help ensure proper oversight strategies to relate information to appropriate agencies. How do you get that conversation started regarding a pilot study?
I would usually start with, just as I mentioned in the example I gave of engaging stakeholder support, where we want to start with our internal stakeholders before we even go to the external stakeholders. I would say that my inclination would be the same in response to this question. I would start looking within the community. Who are the folks that have some expertise, some history, some experience doing that? Are they not yet involved? How do we get them involved before looking too far afield? One of the things that can create some extra hurdles in building partnerships between community health centers and any stakeholder in the any stakeholders in the community is folks feeling ignored, or that their expertise isn't as valued because it's not external. And so I think that's a place that I would start. I would also look at not only not just universities, but community colleges, junior colleges, retired older adults, retired professionals. I think there are a lot of assets in our community that we sometimes overlook going for the consultants.
If I may add, I think it's important to demonstrate what's the added value to the to conducting a pilot study. What's the added value not only to my health center, but to you, to your organization, and what most importantly, what's the added value to the community as a whole? Because a healthy community, a thriving community, a resilient community will just be that much better after a real emergency. So I think demonstrating the added value and what are the gold nuggets of conducting it will be important. But as Dr. Dory had mentioned, let's make sure that we got our ducks aligned internally before we even try to attempt to go out and engage another organization, because we want to make sure that we have a nice solidified message to deliver when in engaging these stakeholders at the community level.
Absolutely. So, pivoting a little bit, how have you all adapted to emergency preparedness planning in this ongoing chaotic state of changes in funding, services, and resources? What have you all been doing?
A lot of meditation, a lot of walking, running, a lot of prayers. Um, uh, Dory, you want to take a first stab at this, or you want me to go along? Okay, I'm gonna give it a
Give
try.
it a
Okay,
shot.
I'm gonna give it a try. Um, it's been extremely challenging. What's most important from a health center standpoint, and I as team leader for outreach, is to go out there to the community and just continue to say, what is our mission, and that we have their back. And when I say that, I mean that in the sense that folks are aware that federal funding trickles down to the state, down to the community level, and there has been significant cuts across the board. And I have individuals approaching me at health fairs or whenever we conduct um, mobile clinics. Um, Folks are saying, "Is are are the services going to end? Are free services going to end, or are there's going to be cancellation of certain programs?" So, uh, as a health center, we are very transparent. We make sure to communicate with our patients, with the communities, and with various stakeholders through the interagency meetings. So I think being transparent is the most important thing given the circumstances that we're undergoing um, as a nation. Anything
Yeah,
else, Dr. Dory?
I would definitely would agree with that, Jean Paul. I think for me, times that are stressful and uncertain and just increased objective challenges and hurdles really highlight even more the value and the need for partnership, where we can be certain that where we have replicated some efforts because we all have our own different flavor or flair or style. We don't do that now. We understand what's needed. We understand the resources we have. We rely on those relationships that we've been building in order to sometimes realign them. Maybe it's temporary, maybe it's not temporary. Maybe it turns out we're more effective with our realignment of resources. And I think listening, listening is crucial. If
Mhm.
you know that I in more than one of my examples talked about mental health and what we've learned locally about the the importance of understanding the impact of emergencies on our mental health individually and collectively, and creating spaces in which, both within our institutions and within our broader community, where we acknowledge that, we accept that, and we promote supporting our mental health. And so, one of the projects that I'm just so fortunate to be a part of, that we're on our fourth year now of just building the capacity of community health activists and leaders to facilitate listening. How do we create those spaces in which we can do that? And what we found is when the neighbors residents in our communities, folks served by our health centers, by our county, when they're asked, what more do you need? Most often, obviously, there are always services and there's anxiety about that, but what they need are safe spaces to talk and be heard. And that becomes all the more critical and heightened in times of emergencies.
Dory with the word. That is beautiful. It's beautiful. You talked a lot about partnerships, right? So how would you all address, how does someone get local entities to partner? Like, how do we get them involved and energized to do this work?
I myself, from Healthcare Network, the great thing about my position is that I am not talking about emergency management. I'm talking about health and wellness, community wellness as a whole. So mm, it allows me to bring emergency management from a different perspective. Um, they see me as a health center representative and not someone from the government or someone who's EM driven. So when I approach folks and wish to engage their organizations, let it be for the planning of a real emergency or for an exercise for that matter, um, it's just a matter of just having a conversation and letting them know what's the added benefit, what's the added value of their participation? How is it going to make their um, organization so much more resilient? So once again, it's just showing what's the added value in playing the sandbox, not only with the health center, but with the various stakeholders. Because when we look at a community, we're not just looking at the community health center, right? We're looking at the various agencies, services agencies, private and non-private for that matter, healthcare, education. So I like to take it to a larger forum, like an interagency meeting or a BOAT for that matter, and have side conversations after I present and just kind of gauge where are individuals in regards to their emergency management planning. And if they're in their initial stages, that's perfectly okay. Um, we health centers, we deal with emergencies every year. Um, but I have found out that when real emergencies occur, we tend to get forget that there are certain processes and documentations that need to be in play in order to count that particular event. So once again, doing due diligence internally prior to taking it externally.
And I would add to what Jean-Paul shared in again, starting with listening and understanding what the concerns are and why they haven't been engaged, if there have been efforts to do some outreach. I think it's important to be clear that there are different ways to participate, and they are all legitimate, valid, and important. I think sometimes potential partners hesitate to get involved because it kind of feels like an all or nothing, or they don't have the resources. Their staff is overextended, and particularly in case during emergencies or when there are multiple emergencies, like when you have wildfires and a pandemic. So I think it's important to really look at the continuum of participation in these collective efforts. And sometimes it's a really solid partnership, and sometimes it starts with just coordinating, sharing information and coordinating, and just making clear that wherever you're able to participate, that helps to add to our collective shared goals, but also helps you achieve your individual institutional goals. It's all good. I think that we don't give that message often enough.
Absolutely. You just got to get the conversation started, right? And then we all work together to get the job done. Awesome, awesome. We want to thank you all so much. We've run out of time for our questions. This is a very robust conversation. You all delivered so much great information. We thank you so much. We hope that we wish you all the best in everything that you do. And we're going to go ahead and move forward. Thank you, Jean Paul, and thank you, Dory. We appreciate you.
Thank you.
You're welcome. All right. Here are some resources that we have available for you all. There are a variety of different things. Next slide, please. Once you receive the PowerPoint, you'll be able to click on these links and look at these resources that are very, very helpful for you as we continue on. Next slide, please. All right. So we will be having more of these sessions. If you enjoyed the first one and you enjoyed this one, we hope to see you for our third one, which will be happening on March 11th. And that one is on workforce readiness. And our final one will be on May 13th, which is on patient supports. If you sign on and click on the link, that is in the chat, I believe. Maybe I'm ahead. But if you sign on for this one, you should be signed up for all of them. We hope to continue to see you there. Next slide, please. And all sessions will be from 2 to 3 p.m. Eastern time. Evaluation. We want to hear from you. What did you love? What other things do you want to hear about? The evaluation should be popping up once this session closes out. You should be receive a link that pops up. Please fill that out and be honest with us. And we want to hear from you. Next slide, please. All right. Again, our next session is on workforce supports on Wednesday, March 11th. We hope you all enjoyed this. We hope you go do something great. As the speaker stated, go walk, make sure your mental's okay, because we all have a lot of work to do. We thank you for being here today, and take care and have a good one. Bye.